Welcome to our first installment of weekly Q&A. This week we had some questions on how the Moderna vaccine can interact with your DNA and what else might be involved with this vaccine. So I have here a nice graphic from Moderna that shows us the component of the vaccine. So here we have the mRNA, which is the recipe for developing these proteins that we want to be surfaced on our cells so that our body creates that immune response. Around there, they've created this lipid capsule, so these are those cholesterols, fats, that allow it to enter into the cell. It needs to fuse with this cell membrane, which is the same similar kind of layer, and then it can release this mRNA into the cell. This is then attached to the ribosome, which is a little factory where it takes the recipe and puts together the components of the protein, and the viral protein chain is then released out to the surface of the cell. And this is where our body's immune system senses it as foreign. It's kind of a flag that says, hey, I don't belong here. Our immune system responds and develops that antibody response. What I want you to note is that this mRNA is out here with the ribosome, outside of the nucleus. The nucleus is where our DNA is. We also do have some mitochondrial DNA, but this mRNA piece does not enter either the nucleus or the mitochondria or interact with them. It is simply kind of translated by this ribosome, and then it goes away and it disintegrates. So there is no way that this mRNA vaccine is going to cause any DNA damage. It's just not possible because of how it interacts with our cell. Furthermore, I've heard concerns that there might be microchips in this vaccine. There are a couple reasons why this isn't even possible. You know, a microchip would have to fit through the needle with these tiny sub-microscopic particles. Furthermore, these come in multi-dose vials, so you have to draw up multiple doses out of the same vial. There's no way that you could ensure that you were getting a microchip into each dose if you were going to do that. So I want to dispel that myth that there are microchips involved with this. It is just it's not possible and it's not happening. And furthermore, this mRNA vaccine is not going to interact with your DNA. It's not going to change your DNA and cause any problems that way. Also of concern lately has been what ingredients are in the Moderna vaccine. So I wanted to just review that with you. Fortunately, it's quite a simple vaccine as far as how many components are involved. There's the genetic material in the form of mRNA. There are the lipids, SM102, and the phospholipid and sterols here, DSPC and cholesterol. Those are all involved in forming that layer around the mRNA that helps it to get into the cell. We also have polyethylene glycol and DMG. This is the group that we are most concerned about. Polysorbate is not in this vaccine, but it's related, and we're concerned about cross-reactivity. That's why it is a contraindication to receiving the vaccine if somebody has had a allergic response to something with polysorbate. Most of us have already been exposed to this in other vaccines. It's quite common and do not have a problem. But again, it's being scrutinized very closely for that concern. And then of course we need some pH buffers, neutral salts, and sucrose. I want you to note that among the pH buffers is acetic acid, which we commonly know as vinegar. So some pretty simple things here to help this vaccine be utilized by our bodies. So again, who can get this vaccine? This has been updated since it was first released because of these allergic reactions, and they're watching very closely. So anybody 18 or over at this point can receive the Moderna vaccine, unless they've had a severe allergic reaction, which we would categorize as anaphylaxis, or an immediate allergic reaction of any severity to either a previous COVID-19 vaccine, mRNA vaccine, or any of its components. And also, as I pointed out, if somebody has an immediate allergic reaction of any severity to polysorbate because of that concern with the connection with PEG, and they're trying to sort out, is this PEG that is causing the anaphylactic reactions? Again, we've had questions about, well, how do I prevent side effects? Our aim is not to prevent side effects from the vaccine, because the side effects that we get from the vaccine are actually our immune system working. So the things that we expect with a vaccine, like injection site pain, swelling, redness, muscle pains, joint pains, maybe even some fever, headaches, nausea, and feeling unwell, all of those things are expected responses that tell us that the immune system is responding. An anaphylactic reaction, on the other hand, where people are having problems breathing, they can't maintain their blood pressure, those are those allergic reactions. But this list of items are things that we would expect and actually tell us that your immune system is responding. Again, with the Moderna vaccine, we expect that the second dose is more likely to have side effects. So for example, if you had some injection site pain with the first dose, you might have more of that with the second dose. You may even have some fever and chills because your body is now developing that immunity. The first dose helped prime your system. The second dose is now developing the response.